Guys, my name is George Alvarez, and today I want to talk about a financial lesson that I actually learned being in the critical care unit as a nurse. So I want to tell this story, and I want to show you how it actually relates to multiple categories of life. So I'm 24 years young, brand new ICU nurse. I'm off orientation, and I come into work and I have two patients. So one of my patients is very, very sick. The other one was very critically ill, but not as sick as the first patient. So I go in, I assess, I do my assessment. I go into the one patient's room, and unfortunately, while I'm in there, the patient starts to crash. So we're doing everything we can, and I'm in there for about 3.5 hours. Meanwhile, I have another patient that I saw in the beginning, but I didn't have a chance to be in the room much because I was dealing with the first patient here. So now after the situation gets settled, I step out, and the attending doctor, who in the ICU is the lead doctor, comes up to me. He says, "George, are you taking care of this patient?" He was talking about the other patient. I said, "Yeah, of course, I'm taking care of that patient." And he asked me, "Where's the eyes and nose?" Which in critical care stands for intake and output. If you're a critical care nurse, or if you're in the healthcare professional, if you've ever worked in the ICUs, you understand how important it is to keep your intake and output current, to consistently measure it every hour on the hour. So he comes up to me, he asks me, "George, where's the eyes and nose for this patient?" I say, "Hey doctor, I've been stuck in this room for 3.5 hours. I haven't even had a chance to catch up on anything. I'm not sure where the eyes and nose are." And by the way, this doctor was a great doctor, excellent doctor. It was a pleasure to work alongside this doctor. I'm not going to say any names, but if you're watching this, you know who you are. Amazing doctor in the critical care unit. And he comes up to me, he's very serious. "George, we need to know the intake and output." I said, "Doc, I don't have it." He said, "No, you don't understand. This information is vital to the plan of care, and we need it immediately because this is a life and death situation. These numbers are extremely important to patients when they're in critical care units." So I got to it, I figured it out, and the day went on. However, that night I went home and I sat and I thought to myself, wow, intake and output is such a serious thing in the ICU. I didn't really think it was that serious. But that day I learned how serious it is, because it's super important for the healthcare team to monitor the intake and output of patients when they're in these conditions, because if there's any discrepancy, if there's a positive or a negative discrepancy, then the patient could be in a very serious issue. There could be many problems that can arise from this. So as a healthcare professional in these settings, it's super important to stay up to date with your intake and your output to see where your patient is, because it can be the difference between life and death. And if you've worked in these settings, you understand what I'm talking about. So I get home that night and I'm thinking to myself, wow, it was so incredible to understand how interesting and important intake and output was. And then I thought about how it relates to every other category of life, how important it is to measure your intake and output. Because if you don't, it can be the difference between life and death, not in the situation of the ICU, however, but in the situation, for example, of your financial life, or for example, in your health and wellness. If you're not keeping up to tabs with your intake and output, that could be a difference between life and death in these situations. Now, what do I mean by this? For example, do you know someone, or have you ever yourself worked so hard, you're picking up overtime, you're picking up all these extra shifts, you get another job, you're working, and it just seems like all your extra work, you don't know where the money is? Where's the money going, right? Have you ever asked yourself, well, when's the last time you checked your eyes and nose, your intakes and outputs? Or have you ever been overweight or underweight, and you go into the gym, you're working out, you're reading the books, you're trying to take care of yourself, right? Keyword trying. And you're asking yourself, I'm putting in this effort. Why am I still not losing weight? Why am I still not gaining weight? When was the last time you measured the eyes and nose? This is something that I learned recently in terms of health and wellness, because I'm currently 11 weeks into a natural bodybuilding program. And I've learned how important intake and output is in terms of your health and wellness. It's 90% 10% is the work you put in the gym, the exercise. 90% is your intake and output. In your financial life, it's probably more than 90%. Because if you're not keeping tabs on what's coming in and what's going out, it's going to lead to financial death. And that is something extremely important that I learned while working in these healthcare settings. The importance of managing your money. That can be the difference between a financially successful you and a financial failure you. The difference is managing your intake and managing your output. Because when you know what's coming in and when you know what's going out, then you can do something that I like to call ITR. Your intake, you need to know it. And then you also need to know your output. And with the rest, you can invest it. ITR stands for invest the rest. In order to invest the rest, you need to know what's coming in and you need to know what's going out. If you do not keep tabs on this, then you cannot succeed. So this is an extremely important concept. And I actually wrote some things down that I wanted to mention here. So financial success versus financial failure. The main difference is managing your money. You need to be able to manage your intake and your output. Just like in the critical care settings, if you don't manage a patient's intake and output, this can lead to a very risky situation. In your financial life, if you're not measuring your intake and your output, it will lead to an extremely risky situation. And in your health and wellness, if you're not measuring your intake and output, it will lead to a very risky situation. So this is extremely important. We have to learn how to manage our money, how to monitor our intake and monitor our output. That way, we know and we can see if there's any net negative or net positive discrepancies. And then if there's net positive, we can ITR, we can invest the rest. You can invest it in yourself. You can invest it in the stock market. You can invest it in real estate. You can invest it in any appreciating asset. You could invest it in having fun, taking your wife out on a date. You can invest it in having an emergency savings. You can invest in different things that matter to you. However, in order to even have something to invest, you need to know your intake and your output. And the other thing that I wanted to mention is something that I've learned through a book by T. Harv Eker called Secrets of a Millionaire Mind. And he mentions this one scripture. And essentially the foundation of the scripture is, until you can show God that you can actually manage what you have, then God will give you more. Why would he give you more if you aren't even managing what you currently have? It's a very interesting point, and it's an amazing perspective to look at. Once you prove that you can handle what you have, more will be given onto you. It's the law, right? Very important concept that I wanted to bring up. And the other thing that I wanted to say is, managing money is more important than the amount of money. I know people who make multiple six figures, and I know people who don't even break 100K, yet they're in the same financial position. Why? Why is it that they're in the same financial position? Maybe it's because one of them measures their intake and output and the other one does not, right? So it's not about how much you make. Remember, it's not about how much you make. It's about how much are you keeping. How do you know how much you keep? You need to know your intake and your output. Extremely important concept. If you don't manage your money, it will manage you. If you do not control your money will control you. So you need to ask yourself, do you want to be controlled by your money, or do you want to take control of your money? If the answer is you want to take control of your money, then you have to start off with understanding what your intake is and understanding what your output is, and knowing the difference between the both. This is where to start. And it's interesting. I've seen it in my own family and my own close friends and myself. Sometimes when you're first starting this, it's so scary because you don't even want to know what your intake and output looks like, right? Just the thought of, man, let me see my intake and output is a scary thought. And because you have that fear, you avoid it. The problem is, if you keep avoiding it, you're never going to get to it. And if you never get to it, then you're never going to know what the discrepancy is. And you won't ever invest the rest because you don't even have the rest to invest in. It's a cycle that repeats. So I just want to tell you, I understand that for some people it may be scary. However, you got to rip the Band-Aid, right? You got to just do it. Take a look at your finances. If you've never done this, do it today. Do it right now. I challenge you to open up your apps, look at your statements. Where is your money going? Have you ever asked yourself, I'm working so hard, yet I don't see the money? If you've never done this, then you need to do it immediately. You need to do it right now. Send this to somebody you love. Do it with them, right? Come home, do it with your wives, your husbands, your families. This is extremely important. This is extremely important. And I learned this lesson in the ICU. I was a 24-year-old brand new ICU nurse, and the attending physician came up to me. He was very serious. He said, this patient's life is on the line. I need the eyes and nose immediately. I need it stat. Like I said, if you're in the healthcare profession, you understand what I'm saying. So I am telling you, if you want to take control of your financial life, you need to understand what your intake and your output is. You need to know what it is. If you want to take control of your health and your wellness, you need to understand what you're putting into your body and what is going out. You need to understand that. It's vital. Vital. So this is a financial topic, financial literacy, super important. Let me know what you guys think about intake and output. If you guys have any questions about how do I even measure my intake and output, where do I even start, right? Please message me, DM me. I will be happy to help. I've done this myself. My wife and I do it on a consistent basis so that we understand and we have a picture so that we know where to ITR, where to invest the rest. Please reach out to me, message me, let me know what you think about this. If you're a nurse, if you're a healthcare professional, let me know if you can see the correlation between eyes and nose in healthcare settings and eyes and nose in your personal life. I hope this is helpful. Send this to somebody you love. Please do this tonight if you've never done this before. And if you have done this before, do it again. Do it again. Write down some goals. Where do you want to invest the rest? See how you can tweak your eyes and nose and see how you can take a look at your intake and your output. See where you can make some more money, have some more income, and see how you can have less output. It's really important. I hope this video is helpful. I look forward to hearing from you guys. Talk to you soon.